First, landmarks are created. The first landmark is the transverse skin incision at cubital fossa, and the second landmark is on lateral elbow. Is the longitudinal skin incision at dorsal lateral aspect of proximal forearm where radial tuberosity locates when forearm is pronated. After the transverse skin incision is made, identify the torn distal biceps, then suture the biceps. The inner and outer rows of continuous locking loop suture technique or cat crown technique are created. 5 stitches on the ascending row and the other 5 stitches on the descending row are made on both inner and outer rows. Fiber wire number 5 is used on the inner row and fiber wire number 2 is used on the outer row. On the inner row, the first stitch of the ascending row starts from the tip of the tendon stump, and the last stitch of the descending row is about 1 cm away from the stump. On the outer row, the first stitch and the last stitch is at 1 cm proximal to the tip at posterior surface for the outer row. At this point, keep in mind that the short head of biceps tendon is medial and inserted distally on the radial tuberosity. Kelly clamp is used to create a tunnel for tendon pathway under the radius to the dorsal lateral aspect of proximal forearm. A longitudinal skin incision is made at the tip of the Kelly clamp. Radial tuberosity is identified while forearm is pronated. The tendon stump is then passed through the created passage and out to the dorsal lateral skin incision. Short head proximally stays medial to the long head biceps. Make sure after passing the tendon, the short head biceps tendon stays distally to the long head biceps tendon. Next, prepare the bone footprint for distal biceps tendon at radial tuberosity. A high-speed burr is used to create a socket with about 1.5 cm long in longitudinal axis. A 2.5 mm drill is used to create the outer bone tunnel from the center of the bone socket and exit at the opposite side of the radius with slightly anterior direction. A 1.5 mm drill is used to create 2 bone tunnels at proximal and distal level of the bone socket. The exits of the bone tunnels stay approximately 5 mm medial to the bone socket border. Double loops of PDS number 1 are used for shuttling sutures back and forth past the lateral stump of fiber wire number 5, which is on the long head portion, from the socket and out through the 2.5 mm bone tunnel that stays at the center, and then assemble it with the button. Then pass the suture stump back to the bone tunnel via the shuttle loop. Then the suture stump is then out of the bone socket, and then fasten the suture stump for the tendon stump to move into the socket and for the button to come closer to the bone. Next step is wanting to pass the fiber wire number 2 through the bone tunnel both sides. So start with passing PDS number 1 first for shuttling the fiber wire number 2 to each bone tunnel on the side. Lateral stump, which is the long head, goes to the proximal bone tunnel, and the medial stump, which is on the short head, goes to the distal bone tunnel. Next, the stump of fiber wire number 5 that is previously passed from the bone tunnel at the center is then passed through the medial side of the tendon stump, which is the short head, using the needle. While tying the 2 stumps of fiber wire number 5, assistant pulls the other 2 stumps of fiber wire number 2 and elbow is in 30 degrees flexion. After that, both stumps of fiber wire number 2 are then tied. Thank you for your attention.